This is a spontaneous video. I have another channel of the life I'm trying to rebuild after a stroke in 2020. For 25 years before that, 25 plus years, I was a nurse and in the healthcare system. But I have been wanting to do this channel for a while, and I realize now is the time. It needs to be done. I am going to be a whistleblower. And my initial thought was I was going to hide behind like images of healthcare workers or whatever. But I thought, you know what? I'm going to show my face because I should not have to hide. I was a nursing assistant, then an LPN, then an RN. I have worked in a variety of settings, and I have been pissed off for years, but this shooting of the CEO, I am with the public 100%. And you guys don't even know the half of it. Oh my God, if I got stories to tell, not just about the corruption in healthcare, but the shitty care by some people. And I want to say up front, it's usually not the nurses. The nurses are doing their best. They're stretched thin. All these corporate idiots in management and middle management, which is way too many people that just sit on their ass behind a desk and tell everybody else what to do. That's a waste of money. I know I'm getting all wound up. Got to keep my blood pressure down. Don't want another stroke. So I have seen it from both sides. As a nurse, nurses try to do their best, but when it comes to cutting the budget or being short staffed, cutting the budget, that's the excuse. We got to cut the budget. The first thing they cut are the nurses, the ones that are doing, and the nursing assistants that are doing most of the work. And let me also just say, because some nurses do have an attitude about nursing assistants, they are the most important people to the patients because they are the one that does the most care. So you better be nice to your nursing assistants and treat them decently. That is one complaint. And treat your fellow nurses decently because nurses can be the meanest damn people you ever met to each other. But they are trying to take care of you. And eventually you get compassion fatigue, which is a fancy name for burnout. Back to the healthcare or lack of healthcare system, I call it. And I was calling it that before I became a part of it. In 2020, I went to bed normal, or normal for me, and I woke up and discovered I'd had a stroke. You can kind of tell. Like Botox on the right side, not on the left. I just need a stroke on the other side to even things out. Just kidding. Um, I lost everything. It was a major stroke. I could not write for 4 months. I could not walk. I got up and I just couldn't walk. I live alone and I fell at the top of my stairs, but fortunately it was spring. The windows were open and I was able to yell for help from the neighbors. And that became 3.5 years of absolute hell, trying to get disability, which I finally got. Of course, now I'm trying not to use profanity. The next administration, I'll use a nice term, is going to cut it and cut everything else for the people that voted for him, that voted against their best interests. So I have been a victim of the system, which is my worst nightmare, starting with going into the ER, and the ER doctor just pronounced like it was nothing. Well, and I have forgotten my meds at times. I've been so busy. And he's like, well, you've forgotten your meds sometimes, and this and that, and you're just going to end up in a nursing home. When I'm sitting in the ER, devastated from a stroke, to say that to somebody, because that is my worst nightmare. Sorry, but I'm keeping it real. I am not going to censor this because I know what goes on there and what doesn't go on there. And I know it happens to people that do not have family members visit. They are the last priority. So if you have people in the nursing home, go visit. Make sure they're being taken care of. Because if you don't go, they're always the last people to get care. We knew, even when I was a nursing assistant, we knew who was going to have visitors. And the nurses would even say to me, make sure you take care of so and so. His wife or her husband will be coming today. This is very important. So, but let's focus on nursing homes today. First of all, they're the meanest damn nurses I've ever met to each other. They're absolutely evil to each other. It's like Lord of the Flies in there, and you do not want to be the piggy because they always pick someone to make their scapegoat. So I can't help. Plus, I've been drinking Diet Mountain Dew. Not a good idea. But the care of the people. First of all, let me be clear, nursing homes are about making money. They don't give a shit about the people in the nursing homes except how much they can make from them. I was an MDS nurse, and those of you in healthcare and long-term care know exactly what that is. I'll tell you what it is. I was the person who put together the paper assessments that were submitted to the government or to insurance to determine how much reimbursement they get for their health care. And guess what? The sicker you are, the more money they make, the higher the reimbursement. And you know what gets them reimbursed the most? Physical therapy and speech therapy, all the therapies. They get reimbursed for that more than for nursing care. So guess what? They want to take all those patients on therapy that are coming out of the hospital. That's why it's so easy to get admitted after you've been in the hospital. They want that money, especially, if you got Medicare, cha-ching. It's big money for them, and they will milk it for all it's worth. Let me tell you something. I was a travel MDS nurse. That means it wasn't just one facility. It was all of them. Everyone I went to, we would have a meeting once a week with physical therapy head to determine where people were in their Medicare payment. You know why? Because that determines how long you get care. When your Medicare is about to run out, they will find a reason to take you off therapy. If you have more Medicare, they will milk it for all it's worth till your therapy benefits are gone, whether they need to or not. And here's how it really works. When you come from the hospital, we have a certain procedure. We do a 5-day assessment, we do a 14-day assessment, etc. But long-term patients that are stable, they get quarterly assessments, the ones that typically aren't on therapy. So guess what we do in those meetings too? We talk about who has an assessment coming up, and we find an excuse to put them on therapy for the week they're getting the assessment. That means we get the facility gets a higher reimbursement if the assessment is done that week. And that reimbursement is for the whole 3 months of their quarterly. They get 1 week of therapy, and the facility gets 3 weeks of the 3 months of the higher reimbursement. Your activities of daily living, feeding yourself, dressing yourself. If something in that changes, you get a few dollars more. So if something changes, somebody has, maybe they're sick a week and their ADLs go down, they need more help. They come into the MDS nurse and say, well, I know you did a quarterly assessment a month ago, but things have changed, so you need to do another one to get more money. So you are constantly having to do and redo assessments. You are meeting with therapy to make sure you milk every dollar out of Medicare and insurance. It's a good insurance plan. That's what gets the high dollars. And it's time that people know that the sicker they are, the more money the facility gets. The less mobile you are, the more therapy you have to have. They will find an excuse to put you on therapy. You have a patient that falls, well, we got to put them on therapy. And let's do another assessment while they're on therapy so we can capture that higher rate. It's a never-ending cycle of exploiting people's sickness, their lack of mobility to make more money. If a patient is sick and is on antibiotics, that's more money. If a patient is sick, is on IVs, maybe an IV antibiotic, oh, big money. Not as big as therapy, but it's a lot more money. So they have a vested interest in keeping you sick. And this is going to be a reoccurring theme with pharmaceutical companies. And I believe most doctors have the right intent, but the pharmaceutical companies have bought the medical schools that come around and they give free samples to get you all hooked on their drugs. And the doctors think they're helping. They're giving you free meds. When in reality, they're making them co-conspirators, the pharmacy companies. And they did that to me as a nurse and to many people. I used to work in hospice. We used to hand out OxyContin like it was candy. And admittedly, we're talking about people with a terminal diagnosis. But they came and they did educational seminars all the time. Oh, it's you can give as much as you want, as much as they need. Some of these people do not die. They have criteria for hospice now. It could be something chronic like COPD, cardiac disease, and you live past the 6 months. We've had people on hospice for years. As long as you still qualify, even if you don't die in 6 months, you're on hospice. We were addicting them to OxyContin. People that were mobile, alert, they still had plenty of life left. And that's the pharmaceutical companies. Oh boy, am I going to get into them? They are so corrupt. They are killing us. They are making us sicker. They're getting us addicted. Everything is you go in for a visit, take a pill, see you, 5 minute visit. And then they charge. They want to charge for millions of visits because then they can bill the insurance company. I went to a doctor or nurse practitioner, actually. Usually they're better. And she was like, oh, when they know I have Medicare because I'm disabled. Oh, it's been a year since your last mammogram, which was completely clear, no problems, no history in my family of breast cancer. I am not going to go spend my whole day going through tests and bullshit so they can make some money for pay a copay. I barely survive on disability, and it's going to be cut even more. I'm not going to go waste my day for something that I don't need. They wanted me to go for, she thought she heard a heart murmur. She wanted me to go to a cardiologist. Well, what if they find a murmur? What are they going to do? It's not that bad. I function, I get around okay. I don't, I have some health problems. What are they going to do? I looked it up. They're going to put me on blood pressure medication. I'm already on it. There is no need to make the visit, but they want the copay. The whole system is corrupt. It is corrupt. And I'm tired of it. And I'm tired of being silent about it. I'm tired of being afraid to speak out. And this is only the tip of the iceberg. And I've seen so much malpractice. And we just kept quiet. I worked at an indigent hospital in Phoenix for people that couldn't afford health care. The criminals, the immigrants, the illegals, the prisoners, your guinea pigs. for med students. And believe me, they fuck up a lot. And I've seen it. I've seen people killed for malpractice. When you go in and the nurses and the doctors, especially the doctors, are extra nice, be a little suspicious. They're probably trying to avoid a lawsuit, which there are plenty of frivolous ones, to be fair, especially with all these commercials for lawyers. Oy, in the middle of Jerry Springer, or now that Steve guy that used to be his bodyguard. Just like, oh, don't get people started. But there are a lot of problems. And I was like, I've been wanting to start this channel and even write a book, Poison for Profits. But I realized the channel is quicker, it's a better way. I've just been so preoccupied with trying to get myself together. And I was not able to get hired in nursing again after the stroke, even when I got a little better, used a walker or a cane because it's a desk job, but they can't run me ragged. They can't pull me to the floor to cover shifts so that I do 8 hours on the floor and then I can go do my job. They can't have me take on call because I can't come in and cover for somebody. Basically, what they've done in the nursing homes, they make the administrative nursing staff, calm down. They make them salaried, and then they're constantly pulling you to fill in holes in their schedule. And so you are working a good 60 hours a week every week for 40 hours of pay. And then when you actually maybe get caught up in a rare moment and want to take a little time off, they're like, well, you have to take PTO. Am I not salaried? Isn't that the whole point? So nurses need to start standing up, not just for your patients, which I hope you're already doing that, but you need to start standing up for yourself because these people are taking advantage of you. And don't think that at least part of the reason isn't because it's primarily a female profession, although there are some men in it. And they know that a majority of nurses, at least it used to be that way, unfortunately it's changing, go into the profession because they really want to care for people and they take advantage of that. I hear nurses saying, oh, we can't unionize. We're professionals. You're professionally being taken advantage of. That's what you're doing. So unionize, stand up for your patients, stand up for yourself. Fight back against the system. It's bullshit. You know what I always say? When the day I had my stroke was the worst day of my life. And it was the best day of my life because it got me out of nursing. I was digging my grave with my teeth. I was miserable every time I walked into, and at the end, I was doing MDS in nursing homes. Every time I walked in under that fluorescent light with all these people just, they always do a picture when somebody comes in and they're like, and then when you see the person, they're just a shell of what they used to be. The system tears you down. It tries to. I even had someone from Social Security admit that to me. They want you to give up. They want you to give in. The people that are on disability or retirement or whatever, don't give in to these motherfuckers. Keep fighting for what you deserve. Fight to make them treat you like an adult, to not talk down to you. Do you want to play bingo? Fuck you. You play bingo. Do you want to go fuck off? I'm going to get a profanity flag. But damn it, I have been talked to so many times like an idiot. And I am not an easy patient because I know, it's like, I know what you're doing. I've been there and I've always tried to treat people like they're human. Even when I was a nursing assistant, I had residents who would say to me, you're the only one that talks to people like when you're turning them in the middle of the night and changing them, call them by their name, say, I'm going to do this. I had one resident say, you're the only one that talks to people. Just come in, flip them over, change them, and they scare them. These poor old people are woken up out of a dead sleep, and some stranger is messing with their privates, changing their briefs. So many people call them diapers. It's so dehumanizing. The whole system is so dehumanizing. But I think that's all for this video. Oh, I have so many more stories to tell. I'm going to start doing this, trying to do this every single day. So I need to fix the Christmas lights. I started decorating for Christmas and I was like, oh, this isn't working. I need to fix that. But this, like I said, this is spontaneous. It's not scripted. It's not AI bullshit. This is the real deal. And the nurses out there, they know I'm telling the truth. And it's probably even worse now in the hospitals than it used to be. So I am going to stop for now. Thank you so much. Stand up for yourself, stand up for your family members, and I hope I see you in another video. Thank you. And now I got to stop the recording.